Hello, and welcome to another episode of where Phyla and Yug, that's me, talk about phage technology and acne. I'm Yug Varma. I am the founder of Phyla. My background is that I am a microbiologist. I've been studying the microbiome for more than 15 years now, and my passion is phages and phage technology. What we're doing at Phyla is pioneering phage technology for acne and other chronic bacterial diseases of the skin. And research has shown that the microbiome impacts acne a lot. And we've known and learned a lot more about acne pathogenesis over the last decades, but we haven't seen a ton of acne innovation in the last 40, 45 years. And so today I am here with Dr. Elisa Song. She is a Stanford, NYU, and UCSF trained holistic pediatrician. She's a founder of Whole Family Wellness in Belmont, California, one of the first and most highly regarded holistic pediatric practices in the country. As an integrative pediatric practitioner, she is really a leader in this space. She's also a lecturer at CEDH, at the Academy of Pain Research, at the Institute of Functional Medicine and Holistic Pediatric Association. And just today I learned that she's also the Chief Medical Officer of Tiny Health. She's also the chair of pediatric education at A4M, which is a great conference. And so welcome, Dr. Song. I'm sure I've left a bunch of things off your resume, but I don't even know how you find time to do all this. Welcome.
Thank you. Yeah, I mean, just like you, my passion is the microbiome. So that is the foundation.
Yeah, that's great. And I'm so excited to see, to hear and learn from your experience and your insights as an integrative, medicine practitioner and a pediatrician, because obviously the biggest sort of section of people who get affected by acne and the first ones are teenagers, right?
Mm-hmm.
And although we've seen an uptick in adult acne over the years, teenagers are really kind of the first and most, I think, important section of the population with acne that you want to intervene in, because obviously there's a lot going on in the teenage years. They're getting acne, but they're also trying to figure out who they are, developing friendships and develop a sense of identity. And I think there's a mental health aspect to acne that they feel very strongly, and which is also probably a part of the treatment paradigm and caring for the patient.
Yeah. I mean, when I talk to kids and teenagers about acne, it's really, I think just with any condition they might be experiencing, when we talk about how health on the outside reflects the health on the inside. And so, I mean, I always start with the gut microbiome, foundations of diet and lifestyle, which it sounds simple, but it makes a profound impact on lasting healing. We don't want to just put Band-Aids on the skin or Band-Aids on, whatever symptoms are going on. And so for my kids, and that's actually the reason why I wrote my book, Healthy Kids, Happy Kids, is to get this knowledge out to parents and practitioners that we need to be respectful and live in partnership with our microbiomes, right? Inside and on us, if we want to really be thriving. And so I always start with the gut microbiome. I love, that Phyla really focuses on maintaining the healthy, normal skin microbiome, which we know can be more disrupted in adolescent, pre-pubertal and pubertal years, with dysbiosis, right? With the Cutibacterium acnes, and instead of just blasting, with topical antibiotics or medications that wipe out your entire skin microbiome, which then can have later consequences on skin health, just really being able to target that one microbe with a phage it's a beautiful concept, and it works. I mean, I have patients where it works. I mean, I want parents and practitioners to really think about when you're putting on, a topical clindamycin or taking an oral antibiotic. Well, let's take oral antibiotics. They're going to wipe out the good bacteria in your gut right along with the bad bacteria that you're trying to target. So you kind of have this mass annihilation, and that can impact your gut immune system development and gut brain connection and gut hormone connection. And so I think respecting and the microbiome and really helping it thrive is really, it's a novel, totally novel idea for the skin. And that's why I was so excited to find out about Phyla.
Yeah, and you're so right, because when you use antibiotics, as you said, it kind of wipes out indiscriminately, good and bad bacteria. So you're trying to catch the bad bacteria and kill it without hurting the good bacteria, but you actually can't do that with antibiotics. And of course, antibiotics are, they're a miracle of modern medicine, and they are very, very effective and life-saving in certain cases. But I think in the case of chronic disease, whether it's chronic gut disease or chronic skin disease, the tools that can be more targeted and that can kill just the bad bacteria without hurting the commensal microbiome, the good bacteria that are just your garden variety bacteria that work day in and day out to maintain your health. That is really, really important, because if you impact that, then you can get into these, really dysbiotic states that sometimes it's really hard to get out of. And then you're in another chronic dysbiotic state. So I think that on the skin particularly, it's a relatively simpler microbiome compared to the gut, right? The gut is really, really complicated. But, we know that Cutibacterium acnes plays a central role in acne pathogenesis. And if you can, very directly and very profoundly target that you can really impact someone's skin health for the better, not just for now or for a week from now. Speaking to what you said about band-aids, if you don't want to just put band-aids and kind of stop things for the short term, it's really about skin health for the long term. I'm curious, I'm sure you educate your patients about phages, and if you recommend Phyla. What is kind of their point of view on this? What do they want? What are their complaints about conventional acne products for acne? What are their comments when they're looking for alternatives? And then, how do they see Phyla as kind of a phage technology?
Yeah, I think that my patients and parents, when they come to see me, I mean, my practice is an integrative pediatric and pediatric functional medicine practice. So they're already, I think, maybe a little more educated and aware about the importance of the microbiome than perhaps a family who hasn't yet, been made aware, right? And so it's not a big leap for my families when I talk about the skin microbiome. I mean, I talk about, babies' poop and microbiome from the moment they're born, right? Even preconception, because the health of the mom's microbiome plays a huge role on how baby's microbiome begins in life, which then has an impact on even later immune and brain health in later childhood and adolescence. So it's not a huge leap to then say, look, we have microbiomes all over us and in us, right? Our skin has its own microbiome. Our heart has its own microbiome. We're finding more and more about the brain's microbiome, and they're all unique and fascinating. And those bugs outnumber us, by trillions, and are such an important part of how we function and live every day. So, and the parents and practitioners who come, they are already aware of the potential adverse unintended consequences of antibiotics. As you said, antibiotics can be life-saving, and when we need them to kill bad bacteria, that's great. But then, the consequence to the immune system or the developing nervous system, or even to mental health of even just one round of antibiotics, needs to be acknowledged so that we can restore the microbiome after antibiotics. So when I mentioned to kids that, hey, there's this one bacteria, one bad player on the skin that, is, it's not the only reason for acne, but it's a big player, right? And there's this one technology, it's basically a virus that eats only that bad bacteria without killing all the rest of the good bacteria in your skin that helps your skin glow and feel good and and recover from acne for the long term. It piques a lot of interest in my families and patients, and With all of the other topicals and oral medications, I mean, what's one of the most common side effects? It's that skin irritation. I mean, face looks bright red. They're sensitive to the sun, and I mean, then they're so dry, and so they're trading the acne for then feeling not great in their skin and worried that they're going to sunburn or whatever it is. And so, with the phage technology, they don't have to worry about that.
Yeah, amazing. Because I think that a lot of people are very cognizant of the damage that, not just acne products, but other skin products can have. And they want to avoid that because they want to take care of their skin, not just for now, but 10 years from now, 20 years from now. And I think that skincare consumers and everyone has to take care of their skin, right? That is kind of something that's top of mind. And as you know, that phages are really present in our microbiome. There's naturally phages on our skin, in our gut, and they're kind of doing stuff behind the scenes every day, all day. But specifically on the skin, it's been shown that phages that kill Cutibacterium acnes, the phages that Phyla uses, are actually much more abundant on healthy skin and more prevalent on healthy skin. And acne skin is actually deficient in these phages. So really what we're trying to do in this particular context with acne is we're trying to mimic an ecological balance that's found in healthy people, right? So and I see phage technology is really just one facet of, I think, microbiome therapeutics and microbiome products. I know you work with Tiny Health, and the microbiome is a focus for them. But in terms of products that incorporate some sort of microbiome, targeted technology, are there a number of products out there? Would you like to see more of them in the future? What's the landscape right now?
You mean for the gut microbiome?
I would say for the gut, but as well as for the skin.
Yeah. I mean, I think that we really have to come to a place where and we're heading there, with microbiome testing companies like Tiny Health and more. I mean, of course, as the probiotic market has exploded in the last decade, right? The supplement market. What most people don't recognize is, of the trillions of microbes in your gut, I mean, to narrow it down to 10 or even 15 or 20 different strain is really it's like a tiny little drop in an ocean, right? And so what I would love to see, and I think we are heading there, is a time where we can really personalize and have more precision microbiome technology, where we can identify some of the imbalances and then targeted probiotic supplements with the foundations, with the prebiotics that really need to feed those probiotics to grow on the skin or to grow in your gut or grow wherever it is. And so, now one of the biggest differences in my practice from when I started over 20 years ago is that I actually no longer recommend a daily probiotic supplement for babies and kids and adults. I think that, just like we want to be judicious with antibiotics, we want to be judicious with, throwing in probiotics that may not be the most appropriate for us. And so this is where, with something like a phage, where you can really target the abnormal dysbiotic organisms that really don't play a positive role on your skin or your gut or wherever it is, while we're also kind of nurturing and nourishing the beneficial flora, knowing that each of us has a unique kind of blueprint of the microorganisms in our microbiomes. I think that's the best way to go. And then we target, probiotics as needed, especially if we can guide it with testing to know, this person needs more, I don't know, phage-bacterium in their gut, or this person actually has way too much bifidobacteria. It's usually the opposite, but way too much. So let's not give a probiotic that has bifidobacteria. Let's target something else. So we're heading there, and I think that's when we're really going to move the needle and see, kids and adults really not being in the state where 1 in 2 kids right now is diagnosed with at least one chronic condition, and really it does start with the foundations of their microbiome and how their gut microbes talk to their immune systems and their brains and to their hormones and all of that.
Yeah, and with probiotics, they're an additive function to the microbiome, whether it's the gut or the skin. Phages really complement that very well because they're a subtractive function, right? And if we don't use phages, the only other subtractive function is antibiotics, which is like a delete all, right?
Yep.
It's like kill everything option. And so the phages, they just present a much more elegant, much more sophisticated option, provided you know that what it is you want to zap, what it is you want to subtract.
Yes.
And that's where it's a combination of testing, right? And then treating, or testing, getting awareness, and then saying, okay, we're out of balance here based on what I know your particular balance used to be or can be, and then shifting that and observing that. So you use Phyla in your practice. Can you give us a little more insight into whether you use it for a certain subset of patients, or there's a certain niche where you see Phyla being really useful in your practice?
I don't know that there's a particular patient profile. I mean, I think when someone is coming to me, with wanting to have support for their acne, I mean, whether they've already tried medications, and I mean, so I would say, my patients kind of run the gamut from families where acne is just starting to become a problem, and they want to kind of preempt, like, how do we prevent this from becoming a major problem? Maybe parents have recollections of themselves having horrible acne and don't want their kids to go through that, and then they're trying to see, how can we make sure that my child has healthier skin as they go through those awkward tween and teen years, right? So that's one subset who maybe have tried some of the over-the-counter, like benzoyl peroxide or something, right? And then I have another subset who maybe they're already on some topical medications, and they're really hesitant to move on to the low dose doxycycline antibiotic, or really hesitant to start on Accutane. And so so even at that point, whether you're starting out fresh, kind of a more of a proactive approach, or a kid, teen, adult who has already tried things and it's not really working, I think that Phyla has a role. So I don't know that I have a particular niche. I mean, of patients, it's more, I think that it's, always going to be helpful to incorporate Phyla and see, what the results are.
Yeah, and we've seen really amazing, life-changing results for patients across the board. So we have patients who have mild, moderate, severe acne, even cystic acne, people who have acne on their chest and upper back, right? Because all of that is kind of this, it's the same microbiome. It's the sebaceous skin microbiome. Again, C. acne is driving a lot of that. And like you said, C. acnes is one of the pillars of acne pathogenesis. It's not the only thing that's going on, but given that it's such a major player in the skin microbiome, it surely has a big impact. If you can rein it in, it has a very positive effect. And I think something that we are starting to understand better, and something that we've definitely seen, but we're under the hood mechanistically we're trying to understand better, is the long-term use of phages in acne. Because as I said, people with healthy skin have more bacteriophages for C. acnes than people with acne skin. So it's already naturally present. I like to think of it as, you have that annoying friend who's like, oh, I never got acne. I don't wash my face, or, have particularly complicated skincare regimes, but I just never got acne. And you're jealous, and you're like, how come I'm on the straight and narrow, and I'm dealing with all this stuff, and I can't eat this, and I have to be very, very careful. But the difference could be that the person who just kind of has naturally healthy skin has more phages on their skin. So for us, it's like, how do we get the phages on, step one, but how do we keep those phages on? Because we found that, especially with people with more severe acne, they apply it and then it becomes undetectable if they stop applying it, right? However, we know that, or our hypothesis is that if you apply it for long enough, for a few months, and people's, I think, time periods will vary for sure, because everyone's skin is a little different. if you maintain that healthy microbiome, that balance in your microbiome over time, over many months, at some point the phages will become native to your skin. They will engraft and they will live there, and they will provide that benefit that people with naturally healthy skin are getting. And so, one part for us as well is kind of the maintenance piece of it. And we say, okay, you've done all the hard work of getting your microbiome in balance. Don't give up that hard work. Don't, lose that lead that you've established. And that's something that I don't know if you've seen with your patients, or even with like other phage products with the gut microbiome. If there's something that you say, okay, you've got to kind of just maintain this a little bit, because it's a chronic health condition.
Yeah. And so I would say, I want to make sure that kids and teens, when they're thinking about acne management, it's really not just like a one-off. It's like, this is part of creating a healthful lifestyle, for your health, for your skin, for all of it, right? It's not just let's just, dab on, right? But that's where Phyla has its system for skincare and all of that, right? So it's really, it's a total. It's really my goal for parents and for kids and for teenagers is to help them kind of rethink how they're viewing what they put in their bodies, on their skins, how they live, the thoughts they have, like how they reframe all of that so that they can really be as healthy as they can be from the inside out.
Yeah. And, in closing, I feel like we're at this really, really interesting time in integrative medicine and holistic medicine, where there's a lot of research coming out. There's a lot of tools to study the human body and in health and disease and compare that. And in the era of sort of big data and even AI, I think we have these tools to be able to mine this big data and understand really what's going on in a kind of a systems biology way, in a very integrated way. How because again, the microbiome is a piece of the puzzle, and in some diseases it's a bigger piece than others, but to understand how these pieces fit together. And from my point of view, as a scientist and as a researcher, I'm excited that we get to take these technologies, interrogate them with these new techniques and insights, and then build products with them. And I'm sure as providers like yourself are like, thank God it's been about 40 years.
Yeah, pretty much.
You've seen a lot of acne innovation, and you're there for it. So Dr. Song, thank you so much for chatting with us. This has been great. Anything else that you'd like to add at the end?
I would say if, you're a practitioner listening, no matter how old your kids are, whether you're seeing a brand newborn or you have someone on the other, end of the age spectrum, if you really just start diving into microbiome science, maybe you are already, I hope you are, but if you start digging into that, you can see so much more profound healing and health for your patients. So I just encourage practitioners to look into that.
Amazing. Thank you, Dr. Song. I'm Yug, and this has been another episode of our series where we explore phage technology and acne. I will see you the next time. Bye.